all for coming out. I particularly want to thank Heartland for going around to different states and putting on forums like this. And I want to commend you for being hardcore healthcare wonks. It takes real endurance to be able to sit in a plastic seat for 3 straight hours. So I'm impressed. I'm too fidgety to do that. So I want to thank you. I also want to thank Nancy Miller, who helps us put on these events and just does a wonderful job making them go seamlessly. I know we got lots of good stuff here, and you folks know a lot more about different areas of healthcare than many of us do, depending on that area. But if I could wrap this up by trying to bring it back to why we're doing what we're doing and what I'm trying to accomplish here in Colorado, it comes down to because I believe we own our own bodies, and I don't believe the government owns our bodies. And I've got a bad back, and I did all those things you're supposed to do. Saw the doctor. He gave me these pills and those pills. He sent me to physical therapy, which apparently was a clever way to say exercise. And that, of course, didn't work. And went to the chiropractor, and that didn't work. And finally, the doctor just said, listen, let's find out what's going on. Go get an MRI. And I said, all right, where do I do that? And he said, well, there are 3 places around here. We like this place over here. I gave that place over there a call, went there the very next day, got an MRI in a new open face machine, walked out with a DVD disc of my back. I had it. That was it. A colleague of mine works up in Calgary. He too, hitting my age, has a bad back. He too did all the other stuff, including physical therapy. And the doctor said the exact same thing. All right, enough of this. Let's find out what's going on. Let's take a picture, go get an MRI. And he said, great, where do I do that? And he said, well, you do it at the state facility. How long will that take? He said, about 52 weeks. 52 weeks to get a look at his back. What did he do that so many Canadians did? Came down south. This got us thinking at independence. Well, wait a second. We hear all these wonderful stories of how little old ladies get onto Greyhound buses, go across the border and buy lots of pharmaceuticals, and everyone has coverage in Canada because they have a single-payer system. So we thought, well, let's go find out for ourselves. We took a trip out to Vancouver and tried to meet some Canadians who have actually lived with the Canadian system. And long story short, we found out one simple thing. Everybody in Canada has coverage. Not everybody in Canada gets treatment. So they all felt very good about having that treatment with them. We met some interesting people. Lynn Gilbert, beautiful young lady in her early 30s. She had a problem when she was in her mid to late 20s. She had 2 small kids, both boys. She was a single mom, and her vertebrae started to shift and started pinching the nerve. The solution for that is a relatively direct spinal fusion. Fuse the vertebrae together so that they don't pinch the nerve. She went to the doctors, and they said, that's what you need. How long will this be? Oh, maybe a couple of years. Now, the pain was tremendous. She was a mom. She couldn't pick up her kids. She was employed. She couldn't work. So they did what they did so well and do so well in Canada. They threw morphine at her. They give that out like M&Ms. Well, so that helped with the pain somewhat, but it also started a morphine addiction. She couldn't work because she was in so much pain. And then it got so bad, she couldn't walk. You'd think then the government was saying, okay, now we'll give you your operation. Well, they didn't pay for that. They did, however, pay for a walker for her to walk around. She went to one doctor who quite blatantly said, I'm sorry, there are older people who've been in the line long before you. You just haven't suffered enough yet. Those terms exactly. Well, it continued to get worse, to the point where she started losing control of her own bodily functions. Did they fix her back? No, but they did pay for adult diapers. Here she is, 27 years old. 2 small kids, 3 years later, because she found one doctor who said, this is ridiculous, let's take care of this. Her life was given back to her. And she says, just like that, my life was given back to me because one man said, I think you should have it. And she has it. She's now doing fine. She's holding down a job, started a business, has 12 employees, and her son is starting to show symptoms of the same thing. What is she going to do? Not wait 3 years. She plans on coming down here. Yes. Another woman we met needed a hip replacement. They're getting pretty popular right here. She had one hip replacement. She needed the other one. What was the wait? 3 years. So bad was it that she needed to sleep every night in a chair to find a position where she could sleep. Finally, she went for relief. She went down here, and within a week, got her new hip. Lindsay McCreath was an interesting man I met. He had bad head problems, and they suspected perhaps that he had a brain tumor, but they needed an MRI. Same story. It was a 4-month wait to see if this man had a brain tumor. What did he do? Well, he met with a broker who arranged for an MRI down south. Came to, I think, Buffalo or someplace. Came back, there it is. There's a huge tumor in my head. The doctor said, oh my, you're right. We need to biopsy this immediately. We need to remove it. It's definitely, it could be life-threatening. How long is that going to take? 4 months. He said, I can't wait that long. He did the same thing. He came down south, had his operation within a week. It was, I think, at stage 2. They got it in time, but had he been forced to stay in Canada, it would have been 8 months before he would have gotten there, and he likely would have died. This caused a pretty impressive lawsuit that went all the way up to the High Court in Canada. He said, you should reimburse me my cost for going down to the United States and saving my life. He lost that suit. Why? Because while they send people down to the United States, this wasn't authorized. He lost. That's why the Premier of Newfoundland came down here just recently for his heart operation. He said, I don't care what it looks like, this is my heart. Not everyone is a premier, not everyone can come down here. I met with a broker who arranged these things, as if he runs this underground railroad that saves people from Canada. And he and I were chatting, and he said, John, whatever you do, make sure you don't do in the United States what we did in Canada with healthcare. And I expected him to say, because if you do, your healthcare will suck too. He said, no, because if you do, we will have no place to escape.